Hello, I'm Ashley Arnold, Vice President of U.S. Drug Test Centers, and I'm very excited today to give you a quick overview of the new DOT oral fluid drug testing that has recently been approved by the DOT, or the Department of Transportation for DOT programs. Oral fluid drug testing will now be allowed for all DOT administrations or agencies, including FMCSA, FAA, Pipeline, FTA, FRA, and also for the U.S. Coast Guard, which participates in the DOT drug testing program. So this new DOT oral fluid drug testing rule became effective June 1st of 2023. However, oral fluid drug testing is not yet operational, as none of the labs are yet to be certified for oral drug testing. Now, it is required that 2 laboratories with an oral fluid collection device become certified by the United States Department of Health and Human Services before the DOT oral fluid drug testing program can begin. We currently have laboratories certified for urine drug testing, which has already been around for 25 plus years. But oral fluid testing is now brand new, and the laboratories need to get certified. So it's going to take a little bit of time for that to happen. But once the oral fluid drug testing is fully operational, employers will have options to use oral fluid testing, urine drug testing, or some combination of both. The employer, though, will be able to make the decision as to when to use oral fluid drug testing, when to use urine drug testing, or when to switch from one to the other. And the employer may have different testing reasons, depending on if it's pre-employment, random, post-accident, reasonable suspicion, return to duty, or for follow-up. Employers may choose oral fluid or urine in some scenarios, or in other scenarios, they can choose to switch from urine to oral or oral to urine. Now, employers will have options to choose the specimen types they prefer to be used for a subsequent collection, such as if there's a shy bladder or a dry mouth or a temperature out of range, which are some of the circumstances that cause a delayed collection process or direct observed collection. So this is going to improve the efficiency of the drug testing process. It'll be best practices for employers to have standing orders or protocols in place with their collection sites for what kind of specimen to use when or for what particular reasons or situations. Now, a professional or a consortium / third-party administrator, such as U.S. Drug Test Centers, will be able to assist employers with these standing orders. So these standing orders should also include employer direction on when to switch from a urine collection to an oral fluid collection and when to switch from an oral fluid collection to a urine collection. The employee or the job applicant, though, will not be authorized to choose what specimen they want to use. The choice will always be to the employer, and if the donor refuses one specimen or the other, they may find themselves with a refusal to test with serious consequences. Employers may also opt to perform oral fluid collections in-house to save time and money as well, just like they've always been able to perform urine collections if they're properly trained, though. If it was their preference, or if that was the preference, in either case, collectors would need to be trained and qualified, and the employer would need laboratory counts for a medical review office or an MRO service to be available to get specimens analyzed at the lab and to get results reviewed and verified by the MRO. So what are some of the key benefits of oral fluid drug testing? It's an easy collection. It's always a direct observed test with no gender requirements. It's a non-invasive specimen collection method that causes minimal health and safety concerns. Employer representatives can be trained to collect specimens on-site at employer premises, and this will help for employers in remote areas with oral fluid drug testing. Now, there is a shorter window of detection to find recent drug use, particularly useful in post-accident or reasonable suspicion drug testing cases, in situations where there may be a wait time because of an inability for someone to avoid a urine specimen, where they go into a shy bladder process, which could go up to 3 hours. So the employer, in that case, can opt to switch over to the oral fluid to eliminate that potential 3-hour wait time. Oral fluid drug test collections are all observed, and again, there's no gender requirements, so this can eliminate the uncomfortable, direct observed urine collections. So what are we recommending for standing orders then? The standing orders we recommend are to use oral fluid testing when in any situation that requires a direct observation. Anytime a donor goes into a shy bladder process after a urine specimen shows a temperature out of range, or it appears that it's been adulterated or substituted. And this is going to lead into a second collection under direct observation in which oral fluid testing should be used. So oral fluid testing can be used in remote areas where finding a collection site is difficult. Employer representatives can be trained, and actually must be trained, to collect oral fluid specimens. And we do recommend oral fluid drug testing for all post-accident and all return to duty testing. Now, it may take 6 to 8 months for labs to become certified, so this is not something that's going to happen overnight. But once they are, we'll have the operational capabilities for DOT oral fluid drug testing. So this is a major change to the industry, and we advise employers to start thinking about it and discussing oral fluid drug testing right away. You have to think of things like, will you use oral fluid drug testing 100% of the time or just in certain circumstances? Will you perform in-house collections? Do you work with a professional who will guide you through the changes and the new processes? And what will be your standing orders for collection sites? So with the oral fluid drug testing new rule, which adjusted the DOT rule for drug and alcohol testing, what we know as 49 CFR Part 40, there are a few other updates and clarifications, but most notably one. All DERs must be available 24/7 to collectors, labs, MROs, and must provide a phone number for availability on the drug testing custody and control form known as the CCF form. DERs must provide a phone number that rings and can be answered at the collection site. It cannot be a corporate office or a call center, so you must be available 24/7 to answer that number. Also, MRO assistants can now discuss with pharmacies the verification of a donor's prescribed medication. So SAPs can perform remote evaluations with certain conditions, and this started whenever COVID was happening, and it's going to continue. So it'll be a permanent part of what the SAP can do, and it'll be nice that they can perform remote evaluations. So hopefully that'll get rid of some of the delays. So U.S. Drug Test Centers is available to assist new and existing clients with the new DOT oral fluid testing updates and all updates and clarifications to the DOT regulation 49 CFR Part 40. At U.S. Drug Test Centers, we have an expert team of professionals that will be able to assist you with lab accounts, oral fluid collection services, medical review officer or MRO services, and standing orders. So stay in touch with us at U.S. Drug Test Centers. You can follow our oral fluid webpage, which is on our website, under DOT Testing and Services, and just look for the oral fluid testing page. For all updates, follow this webpage, keep up to date, keep learning, and get ready. Thanks for viewing this video. Please like and share and call us anytime if you need assistance. Our phone number is 866-566-0261. Thank you.